walk into an emergency room, doctors aren't just listening to what you say. Nope, they're reading these secret signals your body is sending out, signals you probably don't even know exist. Today, we're going to decode those signals, and honestly, what they reveal could save your life. So get this. It all starts with a guy who walks into the ER. He looks totally calm, he's talking normally, and he just tells the triage nurse, "Yeah, my stomach hurts a little bit." No big deal, right? So the nurse says the whole standard check, the drill. On a scale of 1 to 10, how bad's the pain? He kind of thinks for a second and says, maybe a 5. A 5? Sounds totally manageable. But then, and this is crazy, before the guy can even find a seat in the waiting room, she slams the code button. And just like that, all hell breaks loose. A full medical team rushes over. They're surrounding him, cutting off his shirt, jamming in IVs. The guy is just completely bewildered. He's protesting like, whoa, I said my pain was only a 5. And the doctor looks him dead in the eye and says this, "Sir, your body is telling us you're dying. And your body doesn't lie." So what was it? What on earth did that nurse see that made everything he said completely irrelevant? Well, that is the mystery we are about to solve. Okay, so it all starts in the first 3 seconds. They call it the doorway assessment, or my favorite, the eyeball test. It's this lightning-fast evaluation that happens before you even say a single word. And in those 3 seconds, they are laser-focused on 3 critical things: the way you breathe, the color of your skin, and how alert you seem. I mean, this quick glance can be the difference between you going to the waiting room or getting rushed to a trauma bay. And let's be clear, it's not just about if you're breathing. It's all about how you're breathing. Are you using your neck muscles to pull in air? Are your nostrils flaring with every breath? Is it super fast and shallow? See, those are the details that scream emergency. And look at this posture right here. It's called the tripod position. Leaning forward, hands on the knees. It's this primal, instinctual thing we do to try and force our airways open. When an ER nurse sees someone doing this, oh man, sirens are going off in their head. That person goes to the front of the line, no questions asked. All right, the second thing they're looking at is your color. Specifically, they're looking for this, cyanosis. It's this bluish tint that can show up on your skin, your lips, or even your nail beds. It's a direct visual sign that your blood just isn't getting enough oxygen. If a doctor sees blue lips, forget the waiting room. You are going straight back. And the third thing, alertness. And it can be as simple as what this ER nurse said. If you stumble in, you're slurring your words, or you can't answer a basic question like, "What day is it?" That tells them something is seriously wrong with your brain function. Okay. So after that initial eyeball test, they get the hard data, your 5 vital signs. And look, you can say you feel fine all day long, but these numbers, they tell the absolute unvarnished truth about what is really happening inside your body. Just think of this as your body's dashboard. You've got your oxygen level, heart rate, blood pressure, breathing rate, and temperature. And for every single one, there's a normal range, and then there's a danger zone. Like for oxygen, normal is 95% or higher. But if you drop below 90, your body is officially in crisis mode. So what about the man from our story? What was his number? Well, his oxygen saturation was 82%. Just let that sink in. We just said anything below 90% is an emergency. His body was literally suffocating, even though he was sitting there, calm and talking. This is why. It's a terrifying condition called silent hypoxia. Your body's oxygen levels are at a critical low, but because it happens slowly, your brain just kind of adapts. It stops sending out those frantic "I can't breathe" signals. Your organs, on the other hand, are absolutely screaming for help. But it's not just about the machines and the numbers. No, there's another whole layer to this, an assessment based entirely on experience and just pure observation. They are literally reading your body's hidden language. And this right here is the key. Understanding the difference between pain and distress. Pain is subjective. It's the number you give them. But distress, that's objective. That's what they see. Are you sweating bullets? Do you have a look of sheer terror in your eyes? That is your body's true alarm system. And believe me, it is far more reliable than any number you can come up with. I mean, listen to how this ER doctor puts it. It's perfect. Someone with a kidney stone might be writhing and screaming it's a 10 out of 10. but the person having a massive heart attack might quietly say it's a 5, all while being drenched in sweat and looking completely panicked. The distress always gets priority. So beyond just these individual signs, ER staff are trained to see patterns. They are constantly looking for specific combinations of symptoms that act like these huge flashing red flags, triggering an immediate high-level emergency response. And these are the classics. You got chest pain, sweating, and shortness of breath. They're thinking heart attack until proven otherwise. The worst headache you've ever had in your life, and it just came on in an instant. They're thinking brain bleed. Abdominal pain with low blood pressure and a racing heart, that screams internal bleeding. These patterns, they leave absolutely no room for doubt. So, now we have all the pieces of the puzzle. Let's go back to that man at the beginning of the story and finally solve the mystery of what that nurse saw. This is it. This is what she saw in those first few moments. His oxygen was at a terrifyingly low 82%. His heart was racing, his skin was clammy, that's a classic sign of distress. When she touched his stomach, it was rigid, a huge sign of an internal catastrophe. And, maybe the biggest tell of all, he had to keep pausing between words just to catch his breath. His body was screaming for help, even if his voice wasn't. And the diagnosis? A ruptured appendix, which had led to full-blown septic shock. His entire body was being overwhelmed by a massive infection. And the doctor's assessment was blunt. If he had sat in that waiting room for just 30 more minutes, he would have died. That nurse's quick, expert assessment, it saved his life. But there's actually one more thing ER staff check. It's something that can override everything else we've talked about. And it's something you might have right now. The question is, what is it?